Hello and welcome to Mini Medicos. Today I am making a short video on capped succedaneum and cephalhematoma. So, what is capped succedaneum? It is actually a swelling above the periosteal layer of scalp. Above the periosteal layer of scalp. So, what are the various layers of scalp? Here S stands for skin, C stands for connective tissue, A is apocranial aponeurosis, L is loose areolar connective tissue, and P is periosteum. So these are the various layers of scalp, and in case of capped succedaneum, swelling is seen above the level of periosteum. But in cephalhematoma, swelling is localized below the periosteum. Swelling is present below the level of the periosteum of skull bones. So this is the image of capped succedaneum. You can see a large collection seen above the level of periosteum. So this is collection in yellow color. This is image of cephalhematoma, in which you can see a small collection below the level of periosteum. This red color shown in image is hemorrhage or the collection called cephalhematoma. So cause of capped succedaneum occur during delivery of baby if head of fetus stays in birth canal for a long time. So what is the cause of cephalhematoma? It is traumatic, seen in instrumental delivery. Instrumental delivery. In capped succedaneum, pitting is present, but in case of cephalhematoma, pitting is absent. So what is pitting? When we press on the swelling, suppose this is the swelling. When we press on the swelling with finger, there occur depression in the swelling. This is pitting. What are the other features? Capped succedaneum cross the suture line. So suture line is actually between the different bone. Like suppose this is one parietal bone and this is the another parietal bone. So this is the suture between sagittal suture between the two parietal bones. But periosteum is the external layer of bone. If the collection is extraperitoneal, it can cross the suture line, which is seen in the case of capped succedaneum. But if the collection is subperiosteal, like in capped succedaneum, it will be limited by the suture line. So like here, if the collection is present below the level of periosteum, suppose this is periosteum. If the collection is present below the level of periosteum, it will be restricted by the suture line between the two bones. So what we learned here? Capped succedaneum cross the suture line, but cephalhematoma does not cross the suture line. Capped succedaneum is not associated with underlying fracture, but in case of cephalhematoma, fracture is present. Jaundice is absent, jaundice may be present. Jaundice may be present. It is present at the time of birth of baby and disappears within few hours after birth of baby. Not present at birth. At birth, develops later on and takes at least few days to resolve. So this was the difference between caput succedaneum and cephalhematoma. Main difference is caput succedaneum is above the level of periosteum, so it can cross the suture line like here. What cephalhematoma is present below the level of periosteum, so it can't cross the suture line. Thanks for watching this video. Like and subscribe Mini Medicos.